Hi everyone, my name is Ali Graymond. On this channel, I help people recover from OCD. Today, I wanted to discuss the topic of depression and OCD. When you have OCD, obviously, you didn't ask for it. It comes suddenly, and it's really extremely debilitating. So, being in that situation is very, very depressing. And, obviously, as you know, I've had OCD myself at level 10 OCD, like 10 out of 10 anxiety. And it is fully debilitating, you know, when you have it and when you're trying to recover and all of this stuff. So, of course, you're going to feel depressed. You're not going to feel happy. Also, some other feelings you get that are similar to depression is you feel like you want to be isolated. You feel like, but for a different reason. With OCD, you feel like you want to isolate yourself either to avoid triggers or to try to analyze the thoughts. That's what I see a lot of the time. So, but it has that similar kind of feel like a depression where people who are depressed, they also want to isolate themselves, right? And just be in the room. Also, because your mind is processing two different things. It's processing the real world and real life as well as OCD thoughts and fears at the same time. Your brain is doing double the work pretty much all day long, right? So when that's happening, your brain gets more tired. So you will feel more sleepy, more like you can't handle things. And that's again, very like this is how OCD goes. It's not even, I wouldn't even say it's very common. It's pretty much how it goes for everybody who has high level of OCD. They get tired faster and all of this stuff because they're just their brain is processing way more than it's really supposed to all the time. So after a while, it just, it's difficult for your brain to do that, right? And again, that's sleepiness and all of that. That's similar to depression. Also, if you're taking antidepressants for OCD, such as like SSRIs, um, it will have the same kind of side effects, obviously same symptoms, all of that stuff as well. So it is kind of similar, but I've never actually seen a person develop develop a full clinical depression because of OCD. Um, so I'm not saying it's impossible, but I'm saying that I have not seen it. So, in terms of developing depression because of OCD, I think it's more, most people, I mean, pretty much everybody, right, who has OCD because of the situation will feel depressed, but it wouldn't be classified as clinical depression. It would just be a depressive state because of the situation the person finds themselves in having OCD, right? As they clear up OCD, the depression will go away on its own, because it has no merit, no validity outside of OCD. It's just because you have OCD, you feel depressed. So as you recover from OCD, you will stop feeling depressed. And you can recover. I mean, people recover all the time, right? So it's just doing the work every day, just doing the work, not paying attention to the thoughts, no matter how severe they feel, not chasing the relief from anxiety, just saying, yep, I have anxiety because I have OCD. I'm not reacting, I'm moving on, and that's it. And it will feel, extremely, extremely severe for a while, but, you know, as you do this work, your brain will learn more and more that you are not following what OCD is telling you, yet you are perfectly fine. Nothing bad has happened, and it will let go of sending you more new thoughts, and that's how you recover. And as you recover, your depression will lessen as well. So this was just a short explanation about the depression and OCD and how the two relate together. If you have any questions, please leave them below the video. If you haven't subscribed to this channel, please subscribe, and I'll see you in the next video.